virtual meeting of the Board of Supervisors to order, and we are going to try and do this as best as we can, as if all of us were in the boardroom together.
Okay, so what do you say, stop?
So,
Start over? Marita, I'm sorry, we're having difficulties with the YouTube, so can you wait for a moment and then we'll start again?
do I want to participate in Scan Snap? What is that?
No.
Exit out. Exit out, please.
Okay, we're live now, Marita, if you would like to go ahead.
Good morning, colleagues. Good morning, staff. Welcome to the Board of Supervisors virtual meeting. We will try and conduct the meeting as best we can, as if we were all in the boardroom together. So for the audience, if you like, this is going to be, or it is being streamed on YouTube. If you can, please stand. We're going to do the Pledge of Allegiance. Thank you. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Madam Clerk, could you please read out of the closed session we had last week?
Yes, I will. Report of closed session from April 7th, 2020. Item 1, public employment. Pursuant to Government Code Section 54957B1, Title County Council, there was no reportable action taken. Item 2, threat to public services or facilities. Pursuant to Government Code Section 54957, consultation with County Administrative Officer. There was no reportable action taken. Item 3, conference with labor negotiator. Pursuant to Government Code Section 54957.6, County Designated Labor Negotiator Judy Hawkins regarding employee organizations, Calaveras County Sheriff's Management Unit, Calaveras County Public Safety Employees Association, Calaveras County Deputy Sheriff's Association, and Service Employees International Union, and unrepresented employees. There was no reportable action taken.
Do you know of any staff announcements today, Madam Clerk?
I do not.
Does any member of staff
Rich has his
have
hand
something
raised.
they want to say that they didn't get to?
It looks like Sheriff DiBasilio has his hand raised.
Oh, not on mine, but
No.
I'll take your word for it.
Now not on mine either.
Supervisor Callaway, can you hear me?
Yes, I can, Sheriff.
I just wanted to pass on to the board that with the new ruling from the courts that between Friday and yesterday we've let out 19 inmates. That being said, I'm in the process of putting together a couple of guys to do some extra patrols specifically for this. I think I talked to you all prior about our set team that we were doing, special enforcement team. So I'm going to be utilizing a couple of guys to do that probably starting next week. A lot of it is because of the amount of people that we've let out of the jail. So I just want to let you all know that.
So what does that mean in terms of the public? What are they hearing you say?
Well, they're hearing me say that we've let people out of jail that should have stayed in jail because the courts have demanded that we let them out because of the zero bail program that they have implemented upon us. So be very careful on leaving your cars unlocked, your houses unlocked. We've let some people out that probably shouldn't be out. I'll be very honest with you.
Okay, thank you. Any other staff comments? that you know of, Madam Clerk?
No, ma'am.
Okay, I'd like to go to the next agenda item, which is the public health presentation.
Item 1, Public Health Services, to receive an update presentation from staff on COVID-19 novel coronavirus.
Hi, this is Dr. Kaleda. I can give you an update on coronavirus situation in Calaveras County. As of April 14th, 2020, California has 22,348 positive cases with 687 deaths. And Calaveras County now has 9 confirmed cases, 0 deaths, and 6 recovered individuals. So last Tuesday at this time when we talked, there were 5 cases. So in the last week, we've had 3 additional identified cases traced back to the Grand Princess cruise ship in mid-March that were transferred to us when the individuals were released from isolation back to Calaveras County. So that brought our count up to 8. And then yesterday we received an additional report of a confirmed case in a Valley Springs resident who was tested in San Joaquin County and was found to be positive. So again, you've heard kind of the drill. We're still in a containment mode in Calaveras County. Contact investigation has been launched by the county, and on our disease control and epidemiology staff are conducting interviews for the person and household and other community contacts are currently underway. Also additional piece of information is that the conclusion of an epidemiology investigation around one of our previous cases, our 4th identified case in Calaveras County, also a Valley Springs resident, female adult, has been determined to be of community transmission. And there was no clear source of exposure that was released, brought to light by our investigation. So therefore, that's a case of what's called community transmission, and that's a little bit more concerning for potential community spread. We've got information that's new on hospital demand projections because we've discussed as this outbreak continues to evolve, the next phase is a potential influx of hospital patients into our care system and the limited capacity of our hospital to manage that. So that's going to be the next wave of this infection that we're preparing against. So we've got assumptions. So working with the California Department of Public Health and using a model that was developed through Johns Hopkins University, we have some information about that. Now there are some assumptions that are necessary for this model. One assumption is there's an incubation period of 5.2 days after exposure to coronavirus before the person gets sick. The infectious period ranges from 2.6 to 6 days. Unmitigated, what's called row. So row is the statistical description of how many people get the infection who are exposed to a person with the infection. And so that's estimated at 2 to 3. So every person who has the infection is on average going to spread it to 2 to 3 other individuals before it's identified in that person. There's a case fatality rate that's estimated as 1%, and as I've spoken to you before, that's considered significantly high. Hospitalized patients will be 10% of those who are infected will require hospitalization. Hospitalized patients requiring intensive care will be 32%, and ICU admissions who require mechanical ventilation because of respiratory failure will be 15%. And I'll send this information to you after the meeting in an email. As we know, Calaveras County's acute care hospital, Mark Twain Medical Center, has a capacity to care for 25 patients. That's been expanded to 35 with the potential to expand to 50 patients. 8 of those are considered intensive care unit beds. So our projections are as follows. Hospital occupancy for COVID-19 patients is going to range anywhere from 10 to 212. The mean is 122 and the median is 61. So that means that between our best case scenario is 10 patients may require hospitalization, not all at one time, within a 6 to 8 week time frame, but as many as 212 may require hospitalization. That's the worst case scenario. The average is going to be 60 to 122. ICU bed occupancy is going to range from 3 to 80. The mean is 53 and the median is 19. So best case scenario is that we may need to only care for 3 intensive care unit patients in a hospital that has 8 ICU beds. Worst case scenario is 80. Again, not at one time, over a 6 to 8 week period of time. Now, if we superimpose those projections again onto our current hospital capacity, you can see that in the worst case scenarios, there is a significant deficit in the ability of our medical care system to care for those hospitalized patients. So to address this potential hospital care shortfall, public health is setting up and will be able to rapidly activate our alternate care site. So an alternate care site is a place where patients can be taken care of off of the main hospital campus. And the plans for Calaveras County's alternate care site are detailed, have been worked on for several years, and we are going to start setting those plans up. So the Calaveras County ACS site is the Calaveras High School Gymnasium in San Andreas. So we're in the process of moving stored equipment. Monday, the public health staff began to process the deployment of our emergency equipment cache. We're setting up 30 beds at an alternate care site at the Calaveras High School Gymnasium. We broke open 2 large trailers which have been maintained and stored by public health, containing hospital-grade adjustable folded beds, associated medical and support supplies. These supplies are going to be set up and ready to go in the event that they're needed. We have requests for additional supplies being forwarded through the medical mutual aid system to our regional state partners, as well as initial requests being made for staffing. So I want to set up the difference between setting up our alternate care site and activating our alternate care site, operationalizing and staffing our alternate care site. So those are separate concepts. Right now we're setting up the ACS. So we want to have that equipment staged and ready to go in the event that we need to start moving on it quickly. So this is a big deal for our community to be doing this. We are hoping for the best, but we're preparing for the worst. The best case scenario is that we take the ACS down if it's not needed after the next 4 to 6 week period of time unfolds. Also, an additional event since we last since I last updated you is on Monday, April 13th, yesterday at 5 p.m. A local order went into effect by me, the public health officer, issued to the medical community, to the medical providers and licensed healthcare facilities in Calaveras County to report cases of febrile respiratory illness. So as I talked about before, that's a surveillance system where medical providers will be able to report to us daily in real time those patients presenting to them for care who meet the criteria of a febrile respiratory illness. That's by definition fever of greater than 104.4 degrees and cough and respiratory symptoms. So by tracking the daily occurrence of febrile respiratory illness, we feel that we'll be able to get a better real-time indication of increasing occurrence of potential COVID-19 and suspect COVID-19 activity in our community, and be able to do that given some of the lacking capability of testing that we have in the community. So please, any questions on your part, I'll be happy to address.
Any of the board members have questions? I do. When you said an influx into our hospitals, would that be that we could be taking patients from outside the county?
That would be unlikely. I guess in the event of a severe crisis throughout our region, we may, through the mutual aid systems, be asked to care for COVID-19 patients who are outside of our community. But typically, a small hospital like we have is more positioned to transfer patients out of our community as opposed to take patients into our community, given our limited capacity. So our usual mode of operation is to transfer patients outside of our community to hospitals with larger numbers of beds and higher capacity for medical interventions and equipment.
My understanding as of yesterday, there were no COVID-19 patients in Mark Twain.
That's right. That's right. And the census at Mark Twain Medical Center is actually down some because the hospital has put measures into place to keep their hospital census down and reduced so that there's room in the end if there is an influx of patients. They've suspended elective surgeries and they've done other steps to keep their beds open for the time being. Now, financially, that impacts the hospital and impacts medical care systems to not be running at their normal levels of care and capacity. But in the event of a potential crisis, that's necessary and that's being done here as well.
I have a couple more, but I see Supervisor Stopper has a question.
Yes.
Could you on?
Yeah. Few things. You said that we have one community transmission. That's of some concern, and the tracking of it, just because you cannot find where the transmission happened. Correct?
Yes, Supervisor Stopper, that's right. Community transmission is defined as a case of COVID-19 without a known source. And so our investigation hasn't been able to uncover that source. So therefore, this is a case of community transmission. And you're right, that is concerning. Now, I want to remind you that this individual has been under isolation. We've done a pretty exhaustive contact tracing around this individual, and there have been no other cases that have arisen based on contact with this person to anybody, either in their household or in the community at large.
You said we're in containment mode. Recently, California, Oregon, and Washington, all tentatively are starting to talk about what it looks like when we decide to start opening back up, Dr. Clada. And understanding that, like, with what happened in Japan opening early and then having to shut back down due to a new wave coming through, I know this isn't happening tomorrow, but I think some of the discussion needs to be is, we're in containment mode right now. You're focused on what you need to do for the crisis, but some of the discussion is, how do we back out of this crisis when the time comes and we feel it's safe? And we need to start having this conversation sooner than later so that we are prepared for it and we aren't behind the ball when the rest of the world starts getting on their feet.
Well, those are good comments. I can say this. We're looking at this in two ways. Number one, what's the best time to recommend suspension of a lot of the community mitigation activities that have been put into place, such as social distancing, suspension of group activities, those kinds of things. So what's the right time, and how does that roll out? So what does that look like when the time is right? So it's going to need to be a staged reinstitution of all of the normal functions of society. So number one, there has to be good testing. Well, number one, it has to be the right time, okay? And so I wouldn't suggest that you tell your constituents, business community representatives, Chamber of Commerce, whoever, is approaching you with, suggestions or ideas that it may be a good time to start to reopen sooner rather than later, that we need to continue these mitigation activities for the time being. Those are going to stretch into late April, potentially, May, and even into early June. So I would recommend continuing those measures definitely for the time being because they're making a huge difference. Number two, what will it look like when it's time to start to reopen things again? That's going to need to happen in a staged fashion that's part of a process. We'll have to have better testing capabilities in place. We'll have to have a beefed up way of doing contact tracing of people who test positive to prevent them from reintroducing the infection into our communities. And there are certain activities that are going to be considered higher risk than others. Like an example would be what non-essential businesses or what other non-essential activities can be moved over into the category of things that are now permissible, right? So things that could be considered activities that would start to be allowed again would be those activities where people are tending to be less in close contact with each other, in less numbers, that kind of thing. And then there would be higher risk activities that would be the last things to be allowed to be reopened again. Those would be things like large concerts, flying in airplanes. I know that doesn't affect us locally, but those are examples of more high-risk situations and venues that will be the last things on the list to be allowed to be reopened again. So opening the economy and opening our society back up again is going to be a process as opposed to a switch that's just flipped and everything goes back to the way it was.
Thank you for explaining that, Dr. Kaleda. It's pretty much what I was thinking, staged out and being intelligent about how we move forward. I just need a haircut now. I can't get a haircut right now, so. All right, thank you.
Dr. Kaleda, I know you issued a stay-at-home order, but in the Ebbets Pass quarter, because we have many second homeowners, they are coming, they're going, they're bringing friends, family, whomever, and it really has become an issue. I know the sheriff, and if he's listening, he's sort of part of the conversation, his deputies have been stopping crowds, gatherings. But is there something that you could say or do to encourage these second homeowners to stop coming? We know they're second homeowners who are here, who are staying in place, but there are many that are not. And it's a real concern to the community in Ebbets Pass. I'm not sure if maybe we should be writing them letters if we have their names. And some of your colleagues in other counties have, well, the famous one, of course, is Santa Cruz fining 7 guys $1,000, but and others want to bring in the National Guard. So it's become a huge issue, and really the residents of Ebbets Pass need your help.
Well, I understand the frustration, Madam Chair. I can say that we've specifically addressed the short-term rentals, the Airbnb, the VVRO, those groups. When it comes to second home owners, that's a little bit more difficult of a situation to prohibit through legal action. But we have issued the Office of Emergency Services, the EOC, has issued information to the community that discourages people from coming to the community or staying in their second homes if that's not considered their primary residence of sheltering in place. And the order is that people should shelter in place and they should stay home and they should not be, going out for any unessential activities. They should not be congregating in groups. So the activities that you're describing are expressly prohibited by the local health officer stay-at-home order. So we'll definitely reconsider what you're describing and see what can be done about that.
Okay, thank you. Thank you, Dr. K. Mr. Mills.
Yes, thank you, Dr. Kalita, for what your report looks like. One of the things that I have noticed is we are not considered a hotspot in California. Most of the rural communities and counties are not hotspots. We are close to one with San Joaquin County, but this isn't where the real problem is. It's in those cities that are very tightly packed together, and people just don't seem to get it about not moving about. I was in Stockton Thursday and Friday for a cardiologist thing with my wife. I noticed that the number of people driving up to Calaveras County on Thursday between Angels Camp and Farmington was 160 plus cars. On Friday, it went to over 230 cars inbound to Calaveras County. That is no different than any other average day on Highway 4 going through Camaropolis. So I don't know if people are just not getting the message or what it is, but I did look very carefully to be sure that, are these single occupant cars? Are these multiple people driving? And there's a lot of multiple people coming up to Calaveras County for the weekends or to get out of the cities. And evidently the message is just not getting out.
Well, as a medical doctor, Supervisor Mills, I'm not an authority on these types of issues, but I can say that we will revisit this, among the Office of Emergency Services, the other county agencies that are responsible for enforcing the local health officer orders for people to stay at home and shelter in place. And again, like I told Supervisor Callaway, we'll revisit the issue of people moving into our community, going about non-essential activities, and essentially being in violation of that stay-at-home order the way you're describing it. We need to revisit that.
Thank you.
Any other comments or questions from the board? Ms. Stranger, did you have anything you wanted to add?
Yes, this is Kristen Stranger, Health and Human Services. Good morning. I just wanted to do a couple of other reminders and provide a little bit more detail on other arms of the COVID-19 response. So just a reminder to the community that our public health webpage does have the most accurate, up-to-date information in regard to COVID-19, as does the California Department of Public Health and CDC Centers for Disease Control web pages. Just encourage community members to seek information from validated sources. Also remind the community members we've done an outreach in line with the suggestion that Supervisor Stopper made during the last meeting about making sure we share information about existing behavioral health resources. So if individuals are feeling overwhelmed, we have a local crisis line. That information, again, is all on our website. It's in a number of press releases, etc. So just encourage the community to remember that there are existing resources if you're feeling stressed or overwhelmed that are virtual and accessible to anybody. I also wanted to remind community members that to be cognizant of stigma during this time. Remember that we are all fellow community members within this county, and that anybody is at risk of contracting COVID-19 or other communicable types of diseases, and that we want to remind community members that when there is enhanced stigma associated, it might decrease the chances that somebody would be forthcoming in their reporting during our epidemiology research and information like that. And part of that research is to make sure, and part of that tracing and tracking is to try to further prevent the spread. So again, reminding community members that stigma is a very real thing, and we want to make sure that we aren't enhancing that. And we have provided additional resources on our webpage about what you as a community member can do to further reduce that stigma. And then finally, I wanted to give a little bit of information on Project Room Key, just an update of where we are and what's coming, which was the result of policy direction provided by the board at the last meeting on this past Tuesday. So just a reminder, Project Room Key is a California state-driven project to help provide shelter and wraparound support services during the COVID-19 response period. The intent of this project is to, 1, help prevent the spread of COVID-19 by providing quarantine isolation capacities for those who may not have it, and 2, to protect the capacity of our local healthcare system by providing persons who do not need hospitalization the ability to care for themselves. Eligibility for this program is not determined by income, but rather by health and the need to protect individuals and the general public health. There are a number of priorities populations, which I did cover in the last presentation, and I just wanted to provide a little bit of context that any individual could fit into those prioritized populations. That includes first responders, that includes individuals who need isolation capacity. That project is built to address a public health need. It does dovetail nicely into a recently released project that the state has released, which is called, which is a non-congregate sheltering for California healthcare workers program. It was released late last week. It's a state program where healthcare professionals who are providing resources and need isolation capacity can obtain it by utilizing the Cal Travel Store, which is a state program. So there's a number of different venues where some administered locally, some administered by the state, where we are seeking to provide that isolation capacity, and I've been using the bigger we, California as well as Calaveras County, are seeking to provide that isolation capacity necessary for our essential services workers, as well as those that there might be a greater impact to the healthcare services in our community. So with that, I can take any questions on those updates.
Any questions or comments from the board? Okay. If there's nothing else on this item, I'm going to, pardon, Mr. Stopper.
Yes. I've talked to quite a few people this last week, and I really want to re-accentuate the point that Ms. Stranger just brought forward on all the services that this covers, and primarily something that Mr. Clada brought up earlier is that more often than not, we transfer outside the county for certain medical issues, more so than we bring people in, just because our services aren't as stringent as the urban areas. So this will be primarily beneficial for the people of Calaveras County. Am I correct in assuming that, Ms. Stranger?
That's correct.
Thank you.
Okay. Any other?
Rita, the sheriff,
Yes.
I just wanted to talk a little bit about what Dr. Kaleda said with the comment that you made about the folks that were cited down in the Santa Cruz area. I want the public to understand that with the zero bail that has been implemented by the Judicial Council, it's not an option for me to go out and arrest people and bring them to jail because there's going to be zero bail. If it got to the point where Dr. Kaleda felt that people needed to be cited, we could certainly do that under the Health and Safety Code that gives us that authority through his direction. But I just want the public to understand that because we have people coming in from out of county, whether it be their second homes or just to get away from the valley, first off, I don't have the manpower to go out and start arresting people. Two, I really don't want to have to cite people because now that puts our deputies, your deputies, in harm's way if somebody does have COVID. We're limited for staffing as it is, and now I am taking them and having them cite somebody who could potentially be a carrier, and now we're transmitting that disease communicably, and that's not a good option for us. So I think that what Dr. Kaleda has put out, and the fact that myself and Chief Ellis from Angels PD, we put out our statements asking people to do the right thing and to stay out of the county unless they have a real solid reason to be here, that we need people to start doing the right thing. My dad told me a long time ago, locks only keep the honest people out. Well, this order is only going to keep the honest people away. They're always going make sure that the public understands that, one, I don't have the resources, and two, with the zero bail, I'm not going to be able to arrest anybody. We could cite them, but they're going to be right back out on the streets anyhow. So I'm very limited to what I can do, and I just wanted to let the public know that, and you as the board. Thank you.
I think my position, and from what I'm hearing from the community, it's not that we want you, and I don't want you to be arresting and putting them in jail because you're running a really tight ship in the jail. I think it's, citing is maybe the wrong word. Is there a way we can ticket them? Is there a way we can find them? Is there a way, if we knew the name of the homeowners that were going in and out, that we could write them a letter and say, you know, we really like having you here, but now's not the time. I mean, there's several permutations. And I think the concern of the community is the same concern that you're voicing to your officers. You don't want them near these people. The community, i.e., I have to say mostly the residents in Evans Pass, I can't speak for the other supervisors, they don't want to be near them either. And it's because we're such a huge second homeowner district, and they're coming, their friends are coming, their kids, their grandkids, what have you. And I know, as you've said before, the gate swings both ways. There are Calaveras residents that go down to the valley to visit their grandkids or family or friends, to go shopping. It's an issue, I think, that just needs, as Dr. Kay said, maybe some discussion. I don't mean to put it all on the sheriff's office.
I understand. Excuse me. I understand that, and citation, you don't want to use that terminology, but that's actually the only term that we can use. That's what they did to those folks that went to Santa Cruz, that they were actually cited, and they'll end up being fined $1,000, is my understanding. Now, I've spoken with Ms. Stranger, and there is a process in place. They have a call center, they have a phone number that if people are seeing people congregate, that they can call the call center, and then public health will do some follow-up on it. I know for a fact that our deputies went out last weekend to Mokelumne Hill area. We did take it down to Tulloch, but they were at Hogan. They went to numerous areas in the county to disperse people. So we're telling people to disperse. We're doing what we can without doing the citation. When I think Mr. Stopper asked, or you talked to Dr. Clada moments ago about what options are available, and Dr. Clada said that depending on where this thing goes, that he can step up his process, but that in turn does affect law enforcement, because we're the ones that are going to probably end up doing the citation, or code compliance could go out and actually do the citation. That's where the fines are going to come into play. I think we're a long ways from that. I think we have a very few people that are actually doing what they're not supposed to be doing, which is coming to our area. But there are some options for the public out there, as opposed to calling the sheriff's office. They can call the call center, and then public health can do their follow-up. We had Copperopolis had some issues going down there to the Old Corner Saloon last weekend. We're dealing with those as best we can to the sheriff's office, but there are other avenues that people can report these issues to. So the citation is the last thing that we want to do. And again, I certainly don't want to have to arrest anybody, because it's not going to do me any good. They're going to get cited out anyhow. I'm not going to take the chance of bringing them into our jail where we don't have COVID right now. So I just wanted the public and the board to be very aware of the options that are available to us and what we can and can't do.
Thank you, Sheriff. If there is no further comment, I'd like to move on to the next item.
Madam Chair, you need to ask for public comment.
Ms. Stranger, did you want to take the lead on this?
I'm sorry, Madam Chair, you're going to need to ask for public comment on this
I
item
knew that.
before we move on.
Yeah.
Thank you.
Is there any public comment on this topic, please?
Madam Chair, just a question. Is there a delay between the live feed on YouTube and our actual meeting itself?
A little bit.
Okay.
10
A
seconds.
little, oh, 10 seconds.
Thank you.
And you had no emails on this?
I did
Madam
not.
Clerk? All right, thank you.
Would she like you to read
Do you-
Okay, let's move on to the next item, recognition and acknowledgements, please.
Item 2 is from First 5 Calaveras to adopt a proclamation declaring April 2020 Child Abuse Prevention Month in Calaveras County. If you'd like to make public comment on this item, you may begin to call in now.
Thank you. Ms. Stranger, did you want to take the lead on this?
Sure. Would you like me to wait a couple of minutes for the public comment, or?
No, we can take public comment.
Oh, I understand.
We're just instructing people that they can start calling in now so that we don't have to just sit and wait.
Got it. Thank you. Good morning, Kristen Stranger, Health and Human Services Agency. Today, speaking on behalf of First 5 within the Health and Human Services Agency. The request today is for the board to adopt a proclamation recognizing April 2020 as Child Abuse Prevention Month. This is an item that we bring every year, and it's followed by a very powerful and robust Light of Hope ceremony that is usually performed with various community-based organizations, etc. Today, obviously this year is a little bit different, so we're looking to do a virtual Light of Hope ceremony. Our team is working on trying to modify that. But we appreciate the opportunity today to speak with the board as well as the public to just remind everybody that child abuse is a very persistent problem, not only in Calaveras County, in the state, in the nation, and throughout our entire community. Child abuse impacts not only the child, but also the extended community members. And part of the Prevent Child Abuse Council is trying to ensure that individuals know that one of the ways to decrease the potential of furthering child abuse is to be the one, be a supportive partner, person to a community member or a youth in need. And remember that you can always access resources. You can do reports of child abuse to our 24-hour staffed line, and we encourage community members to educate themselves. All of this information is available on our website about what the signs of child abuse may look like. Educate yourself on how, if you do suspect something, how to make that report known so that we can try to ensure that that family has the support services that they need to lead happy, healthy lives. So with that, again, this is being a modified presentation. Typically it has a number of speakers and such, but we did want to make the board aware in the month of April of this very important proclamation. I also wanted to point out that you've been provided statistics that were put together by Child Welfare Services as well as the Prevent Child Abuse Council, and remind the community that those are available on the website as well as an attachment to this item. And that child abuse impacts all. It's not something that is doesn't see various socioeconomic statuses, etc. It is across the board. It has a large impact, and so we wanted to bring that to the attention of the board and the public. And again, if you have any questions, I can take them now.
Does the board have any questions at this time? Supervisor Garamendi.
Thank you very much, Madam Chair. Can you hear me? I know I've got a microphone problem. Does this work?
I can hear you.
You can hear me. Okay, I'm going to get the chance to do the first proclamation virtually, so bear with me. This is a proclamation declaring April 2020 as Child Abuse Prevention Month in Calaveras County. As you all know, I serve on the First Five Commission, and I'm very proud of the work that's gone on around child abuse and taking care of some of our youngest and most vulnerable population. So, whereas all members of the community have a role to play in strengthening families to ensure that children grow up safe, protected, and loved. And whereas children are the future of Calaveras County and deserve our most committed support and protection. And whereas child abuse includes general and severe neglect, physical, sexual, and emotional abuse. And whereas child abuse occurs when people find themselves in stressful situations without community resources and without the knowledge and skills to effectively cope. And whereas the cost of child abuse to a child lasts a lifetime and has cumulative costs for our county. And whereas our community and families are strengthened through social connections, relationships, knowledge, support, and resilience. And whereas research shows that parents and caregivers who seek help in times of trouble are more resilient and more able to provide safety and nurturing for their children. And whereas Calaveras County agencies, schools, and organizations are working to bring attention to the long-term impacts of toxic stress and to implement trauma-informed strategies to support families. And I changed this one up a little bit, Madam Chair. There a fourth annual Light of Hope ceremony. There will be a virtual fourth annual Light of Hope ceremony so that the community can better understand the science of resilience to encourage us all to step up and be the one for a child. Chris and I have attended. This would be my fourth Light of Hope. It is a wonderful ceremony and very inspirational to many of us. It shows how one person can make an impact in someone else's life, and I'm very proud to be able to read this proclamation. So, Madam Chair, I guess it's to you to public comment.
Is there any public comment on this item?
No one has called in yet.
Please proceed, Supervisor.
Thank you. I'd like to make a motion to approve.
Motion by Supervisor Garamendi, a second.
Second. Full second.
Second by Supervisor Stopper. All in favor?
Aye.
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 Please let the record show it was a 5-0 vote. Thank you.
Now, therefore, be it proclaimed that the Board of Supervisors, County of Calaveras, on this 24th date, what is our date? I'm sorry, Madam Chair.
April 14th.
April 14th, 2020, do hereby declare April 2020 as the Child Abuse Prevention Month in the County of Calaveras. Kristen, thank you to all your staff who make this happen and all the volunteers who work on helping be the one for the children of our community. Thank you.
Thank you, Supervisor. Ms. Stranger, has there been an increase since the virus started?
That's a fantastic question. I'm not on you. That's a fantastic question. Actually, we've seen an opposite, right? We've seen a decrease in the number of calls that are being made to the abuse hotline, and that is in line with our state data that we're seeing throughout the state. There are pockets of counties that are experiencing increases, but overall, we, as well as the rest of the state, are experiencing decreases in calls for abuse. So that does not mean that abuse is not potentially still happening, right? This is the reports of the line. I'm simply sharing the data that the reports are not coming in as could be hypothesized. People are home. There's less interactions with others who are oftentimes mandated reporters and such. But that doesn't mean again that the abuse isn't potentially happening. And again, that's why we wanted to make sure this proclamation was brought forward, because it is essential that if people have concerns in our community, they do report those concerns so that we can properly provide the supports to the family to keep the safe.
Has any come in on the hotline? The Count the One line? People having concerns on how to deal with their children.
So we do have pretty robust services, crisis services that we've established through partnerships with the Office of Education and CASA and other types of community partners, Resource Connection, et cetera, that we do have those resources that are available to respond to crisis needs our community. The abuse hotline that I was speaking about earlier is our single line that receives the reports, and that is the one that is experiencing the decrease right now. And that is a different line than our crisis support hotline, which is for general mental health crises responses and crisis mental health services that is available. That line is in a different program and available to you better.
Thank you. Any other comments? Thank you very much. Thank you, Supervisor Garamendi. I'd like to move on to public comment.
General public comment. Any item of interest to the public that is within the subject matter jurisdiction of the board and is not posted on the consent or regular agendas may be addressed during the public comment period. California law prohibits the board from taking action on any matter which is not posted on the agenda unless it is determined to be an emergency by the Board of Supervisors. If public comment is completed before the 30-minute allotted time period, the board may immediately move to the next order of business. If public comment is not completed during the allotted time period, it will be continued as the last item of business in order to provide an opportunity for the remainder of comments to be heard. If you'd like to make a public comment, a general public comment, you may begin to call in now. Madam Chair, we have one public comment that was emailed in, so I'd like to go ahead and read that if that's all right.
Please.
This email was received from Judy Hurley to the Calaveras County Board of Supervisors. The BOS meeting agenda for April 14th should be postponed due to the COVID-19 restrictions. I understand that the meeting is being presented by webinar, online, and by telephone with the numbers listed on the agenda page. Therein lies the problem. I subscribe to satellite internet and have a landline. Cell coverage at my home is very poor. Either I must make a long-distance call for however many hours that the meeting will last, or receive the signal in extremely short blips of sound, 3 to 6 seconds at intervals of 2 to 3 minutes, and or video without any continuity of the meeting discussions and or comment. The latter takes hours and hours to download and replay after all is said and done. In addition, all but one of the telephone numbers listed are out of state. The 669 area code is San Jose. Last week, I was invited to participate in a webinar lasting 45 minutes. It was a dismal failure to attain any pertinent information the broadcast presented. After over 3 hours trying to download and replay, I gave up. These two options offered by the Board of Supervisors are significant burdens to too many of us county residents who live outside the necessary bandwidth requirements. I respectfully request that the Board of Supervisors postpone anything that is not related to the declared national, state, and local state of emergency for COVID-19. It is only fair and democratic that all citizens have the opportunity to be present and to hear and be heard in the usual setting after the COVID-19 restrictions are lifted.
Thank you. Are there any calls coming in, Madam Clerk?
Yes, we have one.
Okay.
Go ahead, you're live with the Board of Supervisors.
Hello?
For the
If you're on mute, could you unmute?
For the caller whose phone number ends in 233, please check to make sure you are not muted.
Hello?
Yes, we can hear you.
Okay, and I've got my computer on mute. I just want to say I agree with the caller that just called. And a matter of fact, I almost couldn't get through because I didn't know what I had to do to call in until I called the office. Anyway, and it's not being put on the screen for people to see. Anyway, what I wanted to do is just ask Dr. Caleta a question about the numbers he's using to decide what Calaveras County should look like with this virus, since it's been around for over 2 months. and we aren't seeing any large numbers of cases. Anyway, I wanted to know if he was using the same numbers that Dr. Fauci was using, the John Hopkins same number, modeling numbers, because it seems that those numbers they've decided were way inflated because of what was put into that. It was a modeling, and it was just numbers that they decided to put in there to make up what could happen. And since then, they've realized that those numbers were way inflated, and now they're reducing in real time what it really looks like. And I would hope that we could do that here, because what he just described is very scary. We're all staying in our homes. Yes, we're trying to keep people out of our county for now, not having company and all of that. So anyway, I wanted to know if that's the case, and if they're planning on taking those numbers and bringing them down to reality. Thank you.
Thank you. Any other calls coming in?
So there aren't any other callers at this time. We don't have a way, I don't believe at this time, to post or reflect the phone numbers on this feed. However, they are listed on the agenda with the passcode. It's right under the call to order on the board's agenda.
I just want to make a comment to the person that just called in wanting to know what model Dr. Kaleda was using for Calaveras County. If you could call the county's community information line, 754, somebody help me with the last 4 digits. Does anyone have it off the top of their head? It's on the county website. There is a community line, and if you call in and ask the question of what model is Dr. Kaleda using, they will get an answer to.
Madam Chair,
754-289-6.
That's correct.
Right. 754-2896, the county's community communication line. Thank you. There's no other calls coming in, Madam Clerk?
No, there is not.
Okay. Let's move to the consent agenda, please.
Consent agenda items are expected to be routine and non-controversial. They will be acted upon by the board at one time without discussion. Any board member, staff member, or interested party may request removal of an item from the consent agenda for later discussion. If you would like to make a public comment on or pull an item from consent, you may begin to call in now. Madam Chair, we have one email asking that item 5 be pulled.
Okay.
And the comment I can read when we address that.
Okay, thank you. Does any board member wish to pull an item from consent? Does any staff member wish to pull a consent agenda item? Do I have an
Yes.
Yes. Mr.
I got a few items here I want to pull, Madam Chair. I need to double check my numbers here. So, just moving forward, these contracts with Health and Human Services, I want to pull items number 6, or 6 and 7. I'm double checking. 7. Yes, 6 and 7.
6 and 7? Okay, thank you.
Also, the final consent item 14. I just had a question of the clerk on 14.
items 5, 6, 7, and 14 are being pulled from consent. May I have a motion on the balance, please?
Move the remainder.
Second.
I'm sorry. Motion by Supervisor Mills, second
Ben Stumper.
by Supervisor Stomper. All in favor?
Aye.
Opposed?
I need you to stop for a moment, please.
Yes.
Thank you. You're moving really fast for me to be able to keep up with you on pulling all of these items.
Okay, I'll repeat. We're pulling item 5, 6, 7, and 14.
Thank you.
And we have a motion by Supervisor Mills, a second by Supervisor Stopper on the balance. And all in favor? 5 ayes and no noes.
Aye.
Okay, let's move to item 5.
One moment, please.
Who pulled item 5?
It was the public.
The public.
Was pulled by a member of the public via email before before today's meeting. Item 5 is from County Council to authorize the board chair to execute a First Amendment to a fee retainer agreement with Remy Moose Manley LLP for ongoing representation in Superior Court Case Number 19CV44446 to increase the not-to-exceed amount by $150,000 for a total not-to-exceed amount of $200,000. The comment from the member of the public was, the county should be spending scarce taxpayer dollars to address the environmental damage caused by commercial marijuana growing, not paying lawyers to fight against its own residents. I urge you to reconsider increasing taxpayer funds to fight its own residents and taxpayers.
I see this more sort of as an editorial versus on what the item is before us. But council, did you want to make any comments?
Yeah, I'm happy to briefly talk through this item. As the staff report details, this is a case in which the county was sued last year. We obviously have to defend ourselves in this litigation. We are being represented very capably by Remy Moose Manley, and it is a CEQA case, and so our hope is to have it resolved relatively quickly, but we do obviously need to continue to work with our outside counsel to defend the county in this matter, and that's why why I am asking the board to increase the total not to exceed amount on this contract at this time.
Thank you. Is there any comments from the board on this? I'll have a motion. Who was that? I'm sorry. Is that Supervisor Garamendi? Motion by Supervisor Garamendi, a second by Supervisor Stopper. All in favor?
Aye.
Opposed? Passes on a 5-0, no opposed vote of the board. I'd like to move to item 6.
Item 6 is from Health and Human Services to authorize the Director of Health and Human Services to execute an agreement with the Amador-Tuolumne Community Action Agency, resulting in revenue in the amount of $71,131 to be used in the response to COVID-19 for homeless housing assistance and prevention, and to be expended by June 30, 2020.
Mr. Stopper, this was your pull.
You're
Could
muted,
you
Dan.
unmute yourself?
Yes, ma'am.
Thank you.
Yeah, I pulled this item to bring up a few points that we discussed during Dr. Calaveras and Kristen Stranger's update earlier on, that primarily this will be to help homeless within our communities. That there's no plan to bring people from outside the community into the area. That would be somewhat in contradiction to the order of the state with shelter in place, and that this can be beneficial moving forward. But I just want to make sure that with the June to end by June 30th and aforementioned to help out with the care and everything that had underneath the capacity of Amador, Tuolumne, and Calaveras counties with this community action agency.
The Kristen Stranger Health and Human Services Agency. Thank you, Supervisor Stopper, for making those points. And I think I could provide a little bit more clarity on this as well. As I had detailed at the briefing last week on the last Tuesday, when it comes to Project Room Key, there's a number of funding sources that are being rated into it that have been provided additional flexibilities in order to meet the prioritized populations and serve those prioritized populations as I had detailed before. So this particular funding source is part of one arm that came out of the state of funding. This is $100 million that was made available to the various continuums of care. We are part of a regional continuum of care. That funding was divided up amongst the various counties, Amador, Tuolumne, Calaveras, and Mariposa counties under that continuum of care. This is it's $71,000, obviously not enough to meet the needs of the project as a whole, but it is a component of funding that would be rated with additional funding sources, such as an additional $50 million that's being made available by the California Department of Social Services, as well as additional flexibilities that have been provided to us to use existing funding sources, approximately $550,000 that have already been awarded to Calaveras County to just address housing needs over the next 5 years. That funding has become additionally flexible to meet the needs of Project Room Key, which obviously does have an expanded population, as I detailed before, beyond that of those who lack stable housing. This is in addition to the final funding sources, which is the FEMA reimbursement when serving those prioritized populations. So it's a it's a multitude of funding sources being pulled together to meet those overarching needs, and the state has been providing additional flexibilities so that we can meet those general public health needs with those funding sources. Oh, and the other piece I wanted to add to it too is, yes, you are correct. The intake process that we are setting up for Project Room Key does prioritize the Calaveras County residents. We are working on a method by which we can identify those individuals, most likely through their Medi-Cal being connected to Calaveras County. But again, those are very much in the developmental stages, but that we have every intention to make sure that we are prioritizing the Calaveras County residents with those services.
Thank you, Ms. Stranger. With that, Madam Chair, if there's no other comments, I would like to move the item.
Any other comments from the board? Any comments from the public on this item?
No, there isn't.
Okay, thank you. Motion by Supervisor Stopper, second please.
I'll second.
Second by Supervisor Garamendi. All in favor? Aye. Yes.
That was Supervisor Toffenelli.
Thank you, Jack.
What did I say?
Garamendi,
But I'm looking at Gary. Did I say Garamendi?
You did.
Second. Apologies, gentlemen, both of you. A second by Supervisor Toffenelli. All in favor?
Aye.
Aye. Opposed? Passes on a 5-0 vote of the board. Thank you. Could we move to item 7, please?
Item 7 is from Behavioral Health Services Mental Health Program to authorize the board chair to sign Amendment 1 to the Willow Glen Care Center Agreement to update the rates charged for residential mental health rehabilitation services for severely mentally ill adults in an amount not to exceed $200,000 for the 2-year period of July 1, 2018 through June 30, 2020.
Mr. Stopper, unmute yourself, please.
I'm going to have to rescind my pulling of that item. I apologize.
Aha, yeah, you do need a haircut. Well, since it's been pulled, are there any public comments on this?
There does not seem to be any public callers.
Okay. A motion, please, Mr. Stoffer.
So moved.
Thank you.
Second.
Second by, let me see, Supervisor Garamendi. All in favor?
Aye.
No, passes on a 5-0 vote of the board. Thank you. We'll move to item 14, Mr. Stoffer.
Item 14 is from the Clerk of the Board of Supervisors, the appointment of applicants to serve on various committees, commissions, advisory boards, and county service areas.
I just had one question here, Ms. Severud, is with the Mental Health Board committee, is it pertinent that the person be a resident of Calaveras County to represent a committee or board within Calaveras County?
It is normally a person who is a resident of Calaveras County. However, there are capacities where maybe they work in Calaveras County and they are advising in their professional capacity. The applications for the Mental Health Board are vetted prior to coming to you. They're vetted by the Mental Health Board Advisory Committee.
I understood. That answers my question perfectly. With that, if there's no other comments, I'm willing to move this item.
Motion by Supervisor Stoffer, a second. Come on, Mr. Mills, haven't heard from you.
Thank you. I'll second it.
Second by Supervisor Mills. Is there any public comment on this item before I take the vote?
There does not seem to be any callers.
All in favor?
Aye.
Opposed? Passes on a 5-0 vote of the board. Thank you.
Madam Chair, can we take a 10-minute break, please?
Yes, we can. Could you technically tell us what we have to do? So just mute ourselves?
I can. You should mute yourselves. And I'm trying to see if there's anything else you should do.
Well, we'll all
No,
do that.
that's all you should do is mute yourself.
I'm worried that we're not giving people enough time because it takes a little bit to call in.
Okay, so we announced at the beginning, so I think that
We did, but we never told them the phone.
agenda. I'm having the clerk of the board read the phone numbers that people may call into, or may use to comment on any one of the two agenda items. Madam Clerk, could you please read the phone numbers and the directions if one's busy, call the other?
Sure.
Thank you.
Okay, so we have a few phone numbers. The first two that I am going to read, the first one is in Santa Clara County. The second is the Pacific Time Zone. The first is area code 669-900-9128. That's 669-900-9128. The next for the Pacific Time Zone is area code 253-215-8782. Again, 253-215-8782. The meeting ID or the webinar ID number is 914-273-049. Webinar ID is 914-273-049. The password for the webinar is 804433. Again, the password is 804433. Okay, so moving on to item 15, it's from the administrative office. To direct the CAO to direct a written notice to the Planning Commission to conduct its review of County Code Chapter 17.91 within 40 days of the notice pursuant to Government Code Section 65853. If you would like to make a public comment on this item, you may begin to call in now.
I was the one that asked to have this item brought to the board. It's been well over a year since we have put this off to the dispensary owners. And I know it is a controversial topic. I understand why the Planning Commission wanted to move it out, but we still need to do the business of the county. And if we keep pushing out items that are controversial, could be controversial, we'll have a very busy schedule, which is all right, but I don't think this is fair to the people involved, and I am concerned about the public. And if this was in a normal board meeting, I'm sure the boardroom would be packed on both sides of the issue. But because of the length of time this has been going on, I felt it's appropriate. I didn't agree with the Planning Commission's decision to move it out to whenever the COVID-19 ends. I've asked to have it put on the agenda. So if there's any board comments on the board packet, I'll take them now. I'll open it up then to any public comment on this item. Madam Clerk, I see someone from Mr. Whalen.
That's County Council's office.
That's
County
me.
Council and Planning are standing by.
Got it. Thank you.
So if anyone would like to make a public comment, they can call the numbers listed on the screen. 669-900-9128 or 253-215-8782. The webinar ID number is 914-273-049, and the password is 804433. Madam Chair, there have no comments or calls at this time.
Thank you. I think I'll just wait a short time longer.
Okay.
Seeing that there are no public comments on this topic, I would seek the board's support. The board is asked to deal with controversial or difficult issues as we move through this, and I felt it appropriate that the Planning Commission also do that. So in this case, what we're doing is asking the Planning Commission to deal with this topic. So I would like your support with a motion, please.
So move, Madam Chair.
Thank you, Supervisor Garamendi. Is there a second?
Madam Chair, I'd like to speak first.
Okay.
I will not be supporting this. I don't think it's right. I agree with the Planning Commission. I think it's being pushed through at a time that it doesn't need to be put through. In the times that we're living in right now, I think it would be very appropriate what they found to do after this crisis is over, when public can come forward and meet and give their opinion on this item. Obviously, there's nobody that's called in on it, so it may be trouble getting through. I don't know. But as you said in your statement previously, probably the room would be full on both sides. And you're very well aware of that. I think this is being pushed through for a personal item, and I disagree. So I will not be supporting this.
Thank you, Supervisor. Supervisor Mills?
Well, likewise, I won't be supporting it. I've received numerous phone calls and emails regarding both agenda items 15 and 16, and that they feel that it is inappropriate at this time, that there's more serious matters that we should be attending to, and that this is not a life-threatening situation for us to be dealing with. So therefore, I would like to see any discussion on this postponed until after the COVID-19 issue is resolved for our county, so that our public can come and look us in the eye and actually have an opportunity to voice their opinion one-on-one with us rather than from a distance.
Thank you, Supervisor Mills. Any other comments? If there's no other comments, I have a motion by Supervisor Garamendi. Is there a second?
Madam Chair, we've been waiting on this item since 2005. The laws changed throughout the state. With this item being that's before us right now, we're saying if the Planning Commission makes no movement in 40 days, then we'll move forward on it. With that, I'll second this item, just on the bare fact that we have a responsibility to conduct business and move forward. We don't know how long this crisis will take. We provided all the equal opportunity for people to dial in if they needed to be able to show up at the board meeting to be able to talk, because they don't have good service, and they have every opportunity to move to where they do have good service to be able to call in or make their time for these meetings. With that, I'll second the item.
Thank you, a motion by Supervisor Garamendi, a second by Supervisor Stopper. All in favor?
Aye.
Aye.
Opposed?
No.
Okay, passes on a 3-2 vote of the board. In opposition, Supervisor Mills and Supervisor Topanelli. In support, Supervisor Stopper, Supervisor Garamendi, Supervisor Callaway. Thank you. I'd like to move to item 16. Excuse me.
Item 16 is from the Division of Cannabis Control to introduce and waive reading of an ordinance amending Calaveras County Code Chapter 9.22, authorize a summary publication, and find ordinance exempt from CEQA. If you would like to make a public comment on this item, you may begin to call in now. And Madam Chair, when we do open it for public comment, I have one email.
Okay, thank you. Are there any questions or comments on this item from the board? Well, I do. I'll start it off. Excuse me. The purpose that we had gone through this process earlier when we did the study session, and the whole time since we brought back this item, was to stick as close as we could to what the state rules were, so that we weren't making things more complicated, not just for the community and the people involved, but for staff. I think we have, the issue for me is the requirements for, I can't find it at the moment, were the requirements for the workers, the ones for the owners of the business. I mean, we were all in pretty much agreement when we had our study session. We are now asking that we do not only what the state requires for the workers, but in addition, we do even more. And I think we need to go back to basics, the basics being what are the state rules, and for the owners should be the same pretty much for the workers, and we should not require a more in-depth analysis than what the Department of Justice is giving us. Excuse me. Oh, so not hearing anything, I'm assuming you all
Yeah.
agree with me.
My apologies, I'm having some issues if you can hear me now. This is Greg Whalen, Madam Chair and members of the board. I'm the Acting Director of Cannabis Control. I apologize if my video is not working at the time, but I hope you can hear me.
Yes, we can. Thank you,
Thank you.
Wayland.
So, yes, the proposed amendments that we're bringing forward for Chapter 922 are in line with the guidance from the board at the March 24th, 2020 session. In addition, it will include a proposed amendment to 9.22040C, which I'll discuss in a moment. In general, these changes are intended to iron out practical impediments in the permit issuing process while fully supporting the intent of Chapter 922 to reduce public safety risks. Specifically, the changes are to subsections 020, 030, and 040 for the definitions, criminal background checks required, and criminal background checks procedures section, which I'll turn to and discuss specifics. Initially, the changes to the definition are for owner, the term owner as it's defined in the chapter, as well as the definition of satisfactorily passed. So the purpose of the change in the definition of owner is to essentially streamline it, make it consistent with the state licensing definition, which is already very broad, and in our view, and in fact, encompasses the all of the categories that are currently in 9.22020K. The definition of satisfactorily passed pertains to owners only, and it means that the owner has completed the background check portion of the state licensing application process. And I'll make that a little bit more specific. It pertains to owners who are not going to be physically present on the property, which is the purpose of the CBCBs, as I'll discuss a little bit more now. The changes to 922 and 030 and 922040 are sort of interrelated with that, in that what we've done is also in line with the study session of March 24th, is striking subsection A and interpreting and incorporating the definition of satisfactorily passed into that section in 9.22040. So 922030A pertains to the issuance of the permit, whereas the remaining two sections pertain to presence on the property. I know that it's a primary concern that anyone who's present on the property have a valid CDCD, and that would still apply under these amendments to both owners and workers. If anybody is present on the property, they're still required to pass the background check process and have a valid issued CDCD. And that would also tie in with subsection 080, which is our enforcement provision. So regardless of whether they're a worker or an owner, if they're present on the property, they're required to have a valid issued CDCD. The remaining change is to 040, and it's the addition of a section that grants the CAO discretion to devise an alternative or additional method for criminal history review. And this is coming to the board because of our present circumstances was one of the main precipitating factors here, is the closure of live scan venues as well as social distancing principles, so that if we're able to engage a third-party contractor to conduct background checks for workers and owners who are actually going to be issued a CBCB, that background check process can be done remotely. It would relieve the Division of Cannabis Control of certain administrative and regulatory requirements and promote privacy and safety of data. Incidentally, these private contractors who run these background check processes do a very thorough job of conducting these background checks, and it's actually broader than what Cal DOJ background check would look like. As an example, included in the discussion section of the item is a list of these additional databases that they would be checking. It includes nationwide county court searches, federal district court searches, DEA alerts, FDA, environment lists, motor vehicle history, and others. So we're encouraged that this is a beneficial addition potentially to Chapter 922. And for those reasons, we're recommending that it be made. I want to emphasize again that these amendments are meant to reflect the practical improvement in this permitting process to make it more streamlined, so that owners who may never step foot on this process, may not even be in California, are still subject to the state licensing requirements. So they're still going through what's called the III background process check with DOJ. In addition, if they ever wanted to step foot onto the property, they would still have to obtain a valid CDCD, and should anybody be located on the property without a valid CDCD, the enforcement provisions of the chapter still apply. It's also important to note that as far as licensing goes, there's sort of a difference between the licensing portion of this and the provisions that would require an individual to have a valid CDCD actually on the property, wherein they can be scanned, checked, and identified. The permit, the actual permit under Chapter 1795 can't be issued unless those absentee owners actually are validated. They have completed the Cal DOJ licensing background process. So we're confident in putting this before the board that this both supports the public safety intent of Chapter 922, as well as introduces some changes that make it more practical and streamlined. And for all of those reasons, it's the recommendation of the Division of Cannabis Control that the board move forward with the introduction of the proposed ordinance changes.
Mr. Whalen, the way I read it, it was a lot more intense than what the DOJ does. Am I not reading that correctly?
I'm sorry, Madam Chair, as far as the use of a third-party vendor is concerned?
Yes, yeah, as far as what we were going to be requiring for the workers was a lot more intense than what would happen if we just followed the DOJ's.
Yes, ma'am. That is correct. DOJ Live Scan report only has convictions within the state of California, whereas use of a professional outsourced contractor like a reputable company like HireSafe, for instance, would be able to run a nationwide search. So all of the states and counties in the United States. So it's far more thorough, and it includes other databases as well that I've outlined.
Well, I guess for me, I thought it was overly done. I didn't understand why we needed to do that intensive of a background investigation. Not sure how many other cities or counties in the state of California require something that intense. I do remember what the sheriff's office had said when we discussed this, but I just felt like it was a little over the top for a requirement, because that person could go work in another county and not have to go through this, but they have to go through in Calaveras. I couldn't understand why. I didn't understand it then. I don't understand now why it has to be so intense. And I know that the applicants have to pay for it, so it's not a matter of money. For me, it was a matter of the principle of it, because we also have the people that hire them do not want people working on their property that they feel would be a detriment, because it's going to harm them as well. So I have no problem with the CAO being involved in doing the background check in terms of what's happening. And I appreciate your bringing up the idea that COVID's had an impact, but I think we shouldn't be asking more than what the DOJ does.
If I may, Madam Chair, I respect that, sir, and we are fully conscientious of that. While it may be that private contractor would cast a wider net, if you will, that does not change other components of Chapter 922 or our evaluation of the results. So, for instance, in the proposed 922040, it sets forth the very same criteria that the board has already passed, and nothing changes that. So what our assessment, our evaluation would be, whatever the results are, if there's anything in the results, we're still doing the very same assessment that the board has approved and given direction on. And those factors, those components are not changing. So while it's sort of a two-part process, it's the background check, but it's also the review process. So I want to assure you that, I understand the concern about the breadth of the search. However, the results and the review and evaluation process are the very same that the board has approved. They're the same components that currently exist and they're the same components that will still exist in subsection 040. I think that the benefits of this, with all respect in our evaluation of this, we feel that the administrative benefits, the legislative compliance relief parts, and the practical situation that we currently have, and should COVID-19 ever become an issue again in the future, or there's something else that may impede the backgrounding process, this would be a useful tool to have. So I hope that addresses your concern.
I hear you. Thank you. Are there any board comments on this or discussion? Supervisor Topanelli.
Yes, thank you, Madam Chair. Greg, I have a couple questions. This third-party background check that you claim is more intensive, they're only going to do the background we direct them to do. They may have the ability to do all this intensive background, but if we don't set it up for that, they're just going to do what we direct them to do. Is that not correct?
Gary, I'm sure that they can, I guess, to use, common parlance is just dial it in to the type of search that we want. What we're talking about is a package or a service that for them may be standard. We still would need to engage them and find out what exactly those packages would be and what the difference would be and whether we want to dial that back. But I think that your comments and your view of this is correct.
Well, the reason I bring that up is this section C on 9.22.040 that's changed to notwithstanding subdivision A and B above, the CAO may, in his or her discretion, devise an alternative and additional method for criminal history review. So that in itself gives the authority to change whatever background check process that they want to do. And reaching out to a third party and contract for their services, then that would be drawn up beforehand, before that contract, and before utilizing any of their services, as to the direction of what background check we are looking for.
Yes, sir. I think that's a correct observation. That there is flexibility built into this, so long as the background check process meets the other requirements of 922.040 E, for instance, the former D, in the existing one, I should say, actually the proposed E, that it covers all of the types of violations that are outlined in that subsection. So the answer to your question or comment is I agree.
May I have for a minute, please?
All right. Yeah, just a moment, Mr. Rock. Supervisor Topanelli, did you want anything else to say on
Not
this?
at this time. Thank you.
Okay, thank you. Mr. Rock?
I wanted to address Supervisor Topanelli's comments. He's absolutely correct. However, we've already gone through that work with the third-party vendor, and what you're seeing in the staff report and what we brought forward in the report before was intended, if you recall from other presentations, intended for us to be able to mirror from a civilian side, mirror what could be done in the III as best we could, not having access to III like Sheriff Frick would have. So we already have all of those things that are identified in the staff report in the background profile, and worked through all of that with the vendor already, and that's how they develop the work that they need to do on each of the background checks on the workers, well, for owners and workers in the original 9.22, and how they set their pricing that an individual would have to pay. So it's consistent with, as close as we could get III, it was consistent with doing as deep a search as we could do on a national level to mirror the criteria that the board wanted us to be able to scan for. And then the last piece of this is also in our ORI application that's been approved. We have not only California DOJ, but we have FBI in that process as well. The disconnect with being able to go through the fingerprint process
now is that the live scan vendors aren't necessarily available for it. So it's not that we, when this was presented in I think March 24th when Ethan presented it, that we're suggesting that we rework that profile. And in fact, the background profile, in my opinion, can't be any stricter. It's as far as we can go to get as close to FBI, the III standards as possible. And so that's already locked in place. It's simply that in some cases we may not be able to do DOJ, so we're asking on the policy end of things to offer an option for us to be able to get employees through a background check of some sort, so that when the owners go through the licensing process and get cleared through DOJ, that they can actually hire people as well, provided we get backgrounds. But you're absolutely correct. We could negotiate all of those, that background profile, and what we have already negotiated is what we've documented here.
Thank you, Mr. Stopper.
Thank you, Ms. Calloway. Notwithstanding that subsection D, which is now E, is fully in there still with those 13 items of convictions, in no way with subsection C can the CAO change those standards. It's just how we're processing those background checks moving forward. All these determining factors here, the 13 under subsection E, are still part of the full process as we do a background check, correct?
Mr. Whalen?
Yes, that is correct.
Thank you.
Mr. Mills?
Yeah, I know that the sheriff has had an opportunity to weigh in the past on these issues because to some degree he will be affected, or his staff will be affected by them. I am not concerned about what the state rules are. I think at times we need to be more stricter. If LiveScan isn't functional right now, the state licensing is shut down. I'm not so certain I want to just arbitrarily, through a board action, allow some type of latitude to just take off in another direction with those basic things that are listed in 040. I'm primarily concerned about, I believe it's in E, where it talks about gang members. Somehow that got removed. Section 3040E, where we excluded gang members. Did I miss something there, Greg?
Mr. Mills, I did not remove any such criteria. I don't know how that may have taken place, but this did not take place in the matter that's being put before the board now. I didn't make that adjustment.
Okay. Thank you. I would definitely like to hear from the sheriff as to what he feels and how this would affect his ability to perform in the field as well as part of this conversation today.
Sheriff, is the sheriff available?
I see that he's one of the attendees here, but just for some historical context, with the exception of the changes here, I don't know the process of what Greg and or Ethan may have done with the sheriff. I think they've been pretty close to him on this, but as we were devising 9.22 in the first place, he and I had regular conversations. And in fact, the third-party vendor that we ended up selecting was one that when the backgrounds were going to be in the sheriff's office that was investigating as well. So that was one of the why we used that as a jump-off point to be able to talk to them. And I see the sheriff's here now.
Sheriff Basilio?
Yes, Madam Chair.
Did you want to comment?
Well, I can. It's nothing that I haven't already said.
I know.
when we brought all this forward way back when, yes, gang members were part of that because it shows the organized crime that gang members tend to do. I don't know when that got pulled out, so I don't know if it needs to be put back in there or not. I think that's something that you're going to catch in your background checks that you do, and that's something that third party that Mr. Alt was just talking about. I'm the one that actually gave him that third party business to look into. They seem to be pretty solid. So to answer your question, Supervisor Mills, I believe that that's going to be picked up. Any gang enhancement is going to be picked up by the background checks through the DOJ with the process that you guys are going to be doing. So I hope that answers your question.
Mr. Mills, did you want to expand?
Well, it's kind of interesting. The majority of the California counties are not approving this whole concept anyway. So I'm just very concerned that we're spending a lot of money and time on an issue that, knowing that Tuolumne County is looking at a potential $10 million revenue loss next year, that we likewise are going to be suffering that same thing. I don't know that this is the way to resolve the problem. So I'm not going to support the changes that are here.
Okay, thank you, Mr. Mills. Any other questions or comments from the board at this time? I'll come back to you. I'd like to open it up to public comment. Do you think, Mr. Tech Department, you could put the phone numbers back up, please, for people to see?
That will be the clerk doing that.
Oh,
So the phone numbers are 669-900-9128 or 253-215-8782 with a meeting ID number of 914-273-049 and a password of 804433. I'd also like to note that if you are having difficulty getting through on any of these, either of these numbers, there are alternative numbers, and I will read through those right now. Area code 346-248-7799 or area code 646-558-8656 or area code 301-715-8592 or area code 312-626-6799. So all of those phone numbers are listed on our cover agenda. If you'd like, Madam Chair, I can read the public comment email that was received.
Please, go ahead.
Okay. This comment was received from Vicki Renke. She has provided 3 different sections that she would like redlined. The first is a question, Section 1, 9.22.020 definitions, M, satisfactorily passed means that either the CAO or after an appeal hearing, an administrative hearing officer has determined that the individual is eligible for a CBCB based on his or her criminal history. In the case of owners, it means that the owner has demonstrated to the satisfaction of the CAO that the owner has completed the background check portion of the state license application process. Her question is, what does it mean to the satisfaction of the CAO? Section 2, 9.22.030, criminal background checks required. She has redlined A, no county commercial cannabis permit shall be issued until all owners of the permittee have satisfactorily passed a criminal background check through the Division of Cannabis Control and received a CBCB. And then the permittee shall ensure that every owner or worker on the county commercial. This item should not be stricken but rewritten to read, no county commercial cannabis permit shall be issued until all owners that will work on the premises have satisfactorily passed a criminal background check, either through the Calaveras Division of Cannabis Control or the State Cannabis Control, and received a CBCB. Section 3, 9.22.040, Criminal Background Check Procedures. The section that she's questioning, notwithstanding subdivision A and B above, the CAO may, in his or her discretion, devise an alternative or additional method for criminal history review, such as entering into a services agreement with a third-party vendor or private contractor that provides background check services. Her question is, what expertise does the CAO have in determining methods of criminal history review? Her comment, this ordinance 9.22 was originally submitted by the Sheriff's Office and DA's Office under their jurisdiction. In the process of approving the ordinance submitted by law enforcement, Supervisors Garamendi, Callaway, and Stopper voted to remove this from law enforcement for reasons unknown and put it under the CAO to administer. Now the CAO is recommending that the county use third-party vendors or private contractors. This process needs to be administered by the Sheriff's Office, as was originally recommended. Local law enforcement should be responsible for administering background checks, not the CAO or outside contractors. Local law enforcement is responsible for our safety and need to know who is working on the marijuana sites. That is all of her comments. I will check and see if there's other callers who are calling in. Please give me just a moment. Okay, we don't have any callers right now.
Okay. I'll wait another moment.
Thank you.
Supervisor Callaway,
Yeah?
might I make a comment while we're waiting for any calls?
Yes.
You had made a comment earlier about the background checks and some of the things that the Sheriff's Office had wanted, and that other counties were not doing what we're doing. I just want you to be aware that there are no counties in the state of California that are doing what we're doing. Monterey County and some of the other counties that are doing commercial growing are either indoors or they're limited to maybe 25 plants. There's nobody else that is allowing the type of growing or has the ability to grow the amount of plants that we can here in Calaveras. So when it comes to the background checks, that's why I was so adamant about continuing with the background process in the avenue that Mr. Alt is doing this, so that we have a solid idea of who is coming to our county. And again, there are other counties that are growing marijuana. It's just nobody is growing it to the capacity that they will be here in Calaveras. So I just wanted to let you know that my concern was for the safety of not only the public, but for our staff, not only my staff, but the co-compliance staff that will be going to these sites to checking on these folks. There's a lot of money at stake in these grows, and that makes people do some different things. So that was the reason why I think that we need to be more strict than what the city is doing. That's just my opinion and my comments. Thank you.
Understand, Sheriff. Thank you. Ms. Everett, are there any calls coming in?
I do not see any, Madam Chair.
unmute.
I do not see any, Madam Chair.
Okay, thank you. I want to close public comment. Ms. Reineke brought up three questions. Mr. Wayland, would you like to respond to them, please?
Yes, ma'am, Madam Chair. So with respect to the first, it's 922020M. It's what it means to the satisfaction of the CAO. In terms of the owners, when they have gone through with their licensing process with the state, what we're looking for is confirmation that they've passed that background check process. That can look like a number of different reasons. I mean, for one, moving the application process forward to, I believe, environmental studies. It also means that in satisfaction in general, satisfactorily passed, there are criteria and certain sort of catch-all provisions in the subsection 040 that we evaluate to confirm that an applicant for CBCB has satisfactorily met the criteria, meaning there's not a non-compliant conviction on the record or something else that meets the equivalent. So with respect to subsection 030, what this subsection, the way that we read these subsections, we look at the chapter as a whole, as all interrelated. So we have the provisions of this section, but we also look at other sections when we're interpreting and implementing them. So the subsection A originally pertained to issuance of the permit and making it contingent upon a CBCB for everyone, including an absentee owner. That's what that subsection served. So what the remaining sections serve now is that there's no one on the property under the new A that does not have a valid CBCB, so that's already there, as well as the enforcement provisions of 080. So we can introduce extra language, but generally speaking, when we're constructing these provisions, we're not looking to utilize superfluous wording, because that can only lead to potential ambiguities or duplication. So for us, it's better to make this more concise, although I respect the views and the comments. So we recommend that the language remain as proposed. Under section 040 sub C, the provisions here grant the CAO, as we've discussed, the discretion to devise alternate or additional methods for the criminal history review. The CAO has, what we have is the expertise to identify and utilize contractors who have a robust and reputable operation that have given us guidelines in the form of contracts that they are going to do X, Y, and Z for us. In this case, as Sheriff DiVasilio and Mr. All previously referenced, there is a particular contract that we already have in mind, although they're not the only one out there that may do this. But that is our expertise in making an assessment of the ability of these contractors to validly and thoroughly perform these backgrounds. So the CAO is able to do that, and that's why this provision is in here for the reasons that I identified earlier, given the pandemic, practical impediments, regulatory relief for the department, as well as administrative relief, and also to introduce a potentially more expedient and streamlined process for conducting these backgrounds, which would then be evaluated, the information that we're given, in light of the criteria that is not changing in former D, proposed E of section 040. So I hope that responds to the comment.
Thank you. Thank you, Mr. Whalen. These are all things that we went through at the study session, and we agreed, either we agreed to agree or agreed to disagree. So I'm closing introduce and waive reading of the ordinance amending Code 9.22. Unless there's any further comment. Oh, I'm sorry, Mr. Stopper, did you have something you wanted to add?
Yeah, I want to thank the sheriff for his continuing involvement in helping, working with the CAO and county council's office and finding adequate vendors and coming up with good input on how to move forward with this. We do appreciate it. I do get somewhat of Ms. Calloway's point with how onerous this is compared to other counties. With that in mind, personally, there's, the county doesn't require any other business to go through this. But at the same time, as we put this forward, we have a certain obligation to our constituents throughout the county that are involved in, let's say, this type of business, that we're making sure that we're going by the standards that our sheriff has proposed in the past, so that we can make sure that we can do the job to keep them in the safest capacity possible. So I'll be supporting this. With that, I'll move this item and the waiving of the reading as proposed by Mr. Whalen.
Motion by Supervisor Stopper. Is there a second?
Madam Chair, I'll second that motion.
Second by Supervisor Garamendi. All in favor? Aye.
Aye.
Opposed?
No.
The motion passes 3-2 with Supervisor Mills, Supervisor Campanelli in the negative, Supervisor Stopper, Garamendi, and Callaway in support. Thank you. I'd like to move to supervisor announcements. Do the supervisors have anything they want to share? Mr. Stopper.
I would like to share an instance of last week with the State Fish and Game Commission had a proposed board meeting. I tried to dial in. It was overwhelmed with the amount of comments from across the state. They were talking about possible temporary ban on sport fishing, motorboats on different lakes throughout the state. They were talking about rescheduling of the meeting. I haven't received the new invite to it, but I'll be watching it closely. This could go hand in hand with what types of business in our future that may open or close first, just because certain social distancing can apply to certain recreational type things and everything. So I'll keep you all tuned in. I'll be definitely dialing in every time the Fish and Game has one of those meetings at the state level.
Mr. Stopper, you might contact Supervisor Terry Woodrow from Alpine County. They have the issue there is a lot more significant than the issue is here, excluding being on the lakes and so forth.
Alpine County, understood.
Okay,
Terry's a good lady.
you. Supervisor Mills.
Yes, thank you, Chair. I had about an hour conversation in a Zoom meeting with Congressman yesterday. One of the things that he brought up is the SBA loan package.
Who?
Congressman McClintock.
Oh.
Thank you. But the SBA loans of $250 billion has almost all been allocated at this point. And for those that were applying, there was as much as a 2 to 3 week delay in bringing those forward. For those that are working with local banks, there are 2 banks in our county, and Kathy Galeno can assist, or the congressman can assist. One of the things that came out of this also is FMLA with government agencies is not treated the same way as it is with a private business, and that they're going to be bringing forward some type of a way to provide us a financial assistance for those government employees that use FMLA during this time. So that's just a piece of this action. Also, there's going to be a noted revenue loss as the feds are now stepping into what would be considered a debt crisis, and that this will domino to us over time. How much of a revenue loss, as I said before, Tuolumne County is looking at about a $10 million next year. We may want to begin to explore from our side exactly what this is going to mean in our ability to provide services over the rest of this year, which is very short, and what we will be doing next year. I've had a conversation going back and forth with Greenhorn Creek and Mike Kristoff. Madera County specifically has adjusted their orders for golf, as well as Amador County and Sacramento County and other counties. So golfing continues to be a kind of a thorn for us as to how do we develop social distancing. For instance, in the Greenhorn and the Saddle Creek golf courses, those are property. Those are owned by those people. So in essence, it is their property that they are being restricted from their ability to use, just like Lake Tulloch is being restricted, even though those people own the property under the water. There's also, for the board to be aware, 2 new tests that have come out for COVID. There is a nasal test that can be done within 5 to 15 minutes, and a saliva test has now been underway. Abbott Labs is putting the first one together. These are very quick tests. They can be done while the person's standing there. So we're moving forward very quickly to find some solutions here to get our population back out and about and doing the things that they like to do. But I think that the board needs to really step back for a second and look at what services we're going to be able to provide as we start to lose our revenue from the various like SB1 or sales taxes or TOT, et cetera, and how that's going to affect our ability to work in the future. So I'd like to see us with some type of a board item that the board can start asking those questions in preparation for next year's budget.
Thank you, Supervisor Mills. Supervisor Garamendi.
Thank you very much, Madam Chair. Yes, it'll be a good conversation when we talk about golf. Clearly what we seem to be doing in Calaveras and the state, knock on wood, seems to be working. I think that, to Supervisor Mills' point earlier, I know we're not debating this, but considering that we are talking about revenues, was brought up. We all know that you don't get out of the mud by putting your foot on the brakes. You get out of the mud by putting your foot on the gas. And I think that's part of what we did today by trying to move 9.22, so we have an economy on the backside of this. But what I wanted to do is I wanted to thank the staff that have been working really hard here at the county, and I too make these meetings possible. I'm really quite proud to be a part of the workforce of this county right now. Everybody's really doing great. I also want to thank the school districts that are trying to continue educating our kids, and some of the private sector folks that are, educating our kids and then delivering food on a regular basis. It means a lot in my district, and it's greatly appreciated. I want to thank the utilities such as Volcano that are providing internet. Most of my district doesn't have high-speed internet, so they're putting up hotspots that people in my district can have access to schools and the world outside, which is great. And then I especially also shout out to a lot of volunteers that are doing amazing stuff that none of us are seeing. It's not getting posted on the internet. They're showing up every day. They're volunteering, and there's some real heroes in our community that are stepping up, not just staff and our first responders, but individuals as well. And I think they deserve a shout out today, because we're doing okay. It's not easy, but people are working hard. So thank you.
Supervisor Garamendi speaks on behalf of the board. Next week, Supervisor Tuffanelli and I have a LAPCO meeting. That will be done in a similar manner to this. Is there any other comments from the board? I'll move to staff. Mr. Ault.
Yeah, I do have a comment to the discussion about golf. I know the board is aware that I was invited to the CCWD board meeting last week, in which the CCWD board asked that Director Michael Minkler issue a letter to the County Board of Supervisors asking that the board reconsider the golf course closures. We haven't received that letter yet. When we do, we'll, along with council, prepare appropriate responses for the board to see. We also, while in this meeting, received a written request to Dr. Coletta from Greenhorn Creek to relax the restrictions on golf as well, citing the Madeira order and the Amador order. So that is an issue that's going to continue to populate our discussions. And with that, I don't have any other comment.
Counselor? Madam Clerk?
Thank you, Madam Chair. In an effort to facilitate the submittal of COVID-19 items, the clerk would like to post agendas on the Friday before the meeting instead of Wednesdays, as is the usual practice. We wanted to let the board know that.
Is there anything else?
No.
Nope. Okay, this meeting is adjourned, and board members, we're not adjourned.
Well, you're going to go to closed session, so you're going to recess this meeting. We should read the closed session items and ask for public comment.
Oh. Got it. Thank you for being corrected. We're going to be going into closed session, Madam Clerk. Would you please read the two closed session items?
Yes. Item 17, pursuant to Government Code Section 54956.9D1, conference with legal counsel regarding existing litigation, California Sport Fishing Protection Alliance v. Eastern San Joaquin Groundwater Subbasin Sustainability Plan et al., Stanislaus County Superior Court Case Number CV 20001720. And item 18, public employment pursuant to Government Code Section 54957B1, title County Council. If you would like to make public comment on either of these items, you may begin to call in now. The phone numbers are area code 669-900-9128, area code 346-248-7799, or area code 646-558-8656, or 253-215-8782, or 301-715-8592, or 312-626-6799. The webinar ID number is 914-273-049, and the password is 804433.
Okay, board members, we will be going into closed session. We're going to take a 10-minute recess so you can get your coffee or whatever. Thank you. Thank you for a good meeting. I appreciate it. Now post.
I'm sorry, we couldn't hear you.
Is Al going to take over as the host?
Yeah, there is a different meeting call-in number for the actual closed session.
Right, I know. Okay.
So you're going to recess now at